some reminders about some of the provincial announcements that we have seen over the last couple of days. There's been quite a number of new provincial announcements. So firstly, the province announced booster doses for a very specific segment of the population. So third doses for these individuals. There's really two main categories of individuals eligible now for a third dose or a booster dose. So the first is individuals with specific medical conditions that have led to the immune system being compromised. And the province is very clear about what conditions are included in this list. So it includes individuals that have received transplant, so whether or not it's a solid organ transplant or stem cell transplant. Individuals that are currently undergoing active treatment for a hematologic malignancy, so types of blood cancers, and individuals that are on very specific immune suppressing medications. So there's a class of medications that are called anti-CD20. So these individuals would be eligible for a third dose. At this point in time, we are not offering the third doses as walk-ins to any of our clinics. The ministry has indicated that they are working with the different physician specialist and treatment programs, also in collaboration with the health unit to ensure that there is access to the vaccines for these third doses. It might be through very specific clinics or physician offices. Those details are coming, but at this point in time, we are not accepting walk-ins for third doses at the HKPR-led clinics. And the other group of individuals that are eligible for a third dose of vaccine are residents of long-term care homes, certain high-risk retirement homes, and elder care lodges. And so our teams are starting to work closely. And again, this is a very recent announcement to look at how we can support delivery and administration of COVID-19 vaccine for these settings. I will note that the time interval between the second dose and the third dose is slightly different for those two groups. So for long-term care home residents, the time interval is 5 months after they received their second dose. So if it has been 5 months since the second dose, then they're eligible for the third dose. And for individuals meeting the specific medical condition criteria, it has to have been at least 2 months since their second dose. So very specific criteria that the province has made a decision about a third dose based on emerging evidence and a current risk assessment with the Delta variant that is circulating.